Good afternoon, everyone. Thank you for joining PICA and Patient Experience Network this afternoon for our webinar on spotlighting excellence in patient experience. My name is Jenny. I'm the Chief Research Officer at PICA. And I have the privilege of chairing the session and leading us through the selection of presentations that we've got this afternoon. And we're joined by true leaders in the field of patient experience and championing the importance of listening to and learning from communities to improve person-centred care. So I hope you enjoyed the lineup that we've got for you all this afternoon. And really that's what PICA is all about. So we're a charity and we exist to promote highest quality person-centred care for all always. And we do that through our work with policymakers, providers, practitioners, members of the public to understand and measure people's experiences of care and to ensure that people's experiences are valued by all. We've supported the Patient Experience Network Awards for a number of years now, and we're delighted to bring you this webinar to be able to showcase some of the exceptional projects recognised at PEN Awards 2023. So before I hand over to Ruth to tell you a little bit more about the Patient Experience Network and associated awards, I'll do a little bit of housekeeping. So you'll see on this slide, we're recording the webinar and it's going to be published on the PICA and PEN websites. So by attending the webinar, we're assuming you provide permission to be recorded. I know many of you have got your camera on, that's absolutely fine, but we would ask that you remain muted, and I think we've kind of set that up ourselves. We've got a lot to get through this afternoon, so we just want to make sure that we can give our presenters time to be able to talk about their work and experiences. And we have a Q&A session actually at the end of the webinar. And that being the case, please use the chat function to kind of share your reflections and any questions that you may have for our presenters, which we can get to at the end of the session. Where we don't have time for to discuss all questions, we'll make sure that we're collecting them all, adding them to the web page where we're going to be storing the recording as well. So that being said, I'll hand over to Ruth, the MD of PEN, just to finish this introduction segment off and to say a little bit more about Patient Experience Network and why it matters and why we're hearing from you good speakers today. So Ruth, I'll hand over to you, please.
Thank you, Jenny, and welcome everyone, and thank you so much for joining us today. We are the Patient Experience Network and PICA, and we have been working together for several years, as Jenny said. You may have heard about both of us, but just to let you know a little bit more about PEN. The Patient Experience Network, or PEN, has been around for 13 years. Yes, we are a teenager now, and we are still growing. And we set up back in 2010 to really give give people the opportunity to have the balanced conversation, to focus on what is working well, as well as the plentiful opportunity to focus on what's not working well. So we wanted to give a vehicle, a process, if you like, to put the spotlight on good practice, support organisations to recognise, share and celebrate that, but also to then work out how we can embed, sustain and measure it more effectively. We're a not-for-profit, as I said, and we have been delighted to work with so many wonderful organisations. The PEN National Awards, or PENA, are one of the vehicles that we use, particularly to put the spotlight on good practice. And this award has also been running for 13 years. And we are going to hear today, and it's very much a privilege to hear today from our speakers, because they have been willing, courageous enough, and willing to share their best practice and in many ways kind of put their head above the parapet. You can imagine it's very busy in the world that we're in at the moment, and your worlds are massively busy, and to be able to just put aside a little bit of time to reflect on what you're doing, collate it and pull it into a submission, and then be able to share it at the award ceremony and today is a massive ask, and we're hugely grateful to you for doing that. I was just explaining, I've been stood out in the cold for longer than I was expecting today, and I think it's impacted my ability to speak. So it's today it's celebrating their great work, and I'll tell you a little bit more about the dates for next year if you're inspired to put forward your best practice for 2024. Louise is also joining me, so if you've got any questions about how to enter, what we're for, where to find the best practice, all that, Louise will be online as well to take your questions in chat, and we will point out the resources that you're going to be seeing today, where you can find them on the website, but also where else you can find. We've got hundreds of case studies, so whatever your area, we've probably got an example of best practice for you to have a look at. So on that note, I think I should probably hand back to Jenny. Before I do that though, I should just say thank you to PICA for supporting this. Thank you to our speakers, because it's a big ask to carve out more time, but we're hoping that it will sow and reap benefit for you. But thank you to everyone who's joined us today, because this is what we're here for, is to share the brilliant work, and we're delighted that you've joined us today. I'm going to hand back to Jenny.
Thanks so much, Ruth. Yeah, so let's crack on with things. Let's get over to our first speaker. So I'm delighted to introduce to you Sarah Tell. Sarah is a friend of PICA, a friend of Penn, patient partner, and Sarah's the winner of the Patient Contribution Award, the showcasing an outstanding patient partner at Penn 2023. So congratulations, Sarah, for that. Sarah will be sharing her reflections of her lived experience and experience of being a patient partner. Sarah doesn't have any slides to show us today, so we're just here to kind of listen and learn from Sarah's experience. So Sarah, please go ahead when you're ready.
Okay. Do with me, not to me, together. Hello everyone. Yes, my name is Sarah Turl, and for the last 9 years, I've worked together with staff and other patients, developing patient partnership. It is particularly special being here today because Penn and I go back to 2017, and they have been such a good friend to me in not only believing in me, but offering opportunity to share my work. And with a more recent developing relationship with the good folk at PICA, just lovely to be here, sharing this platform with equally dedicated people. And I'm so looking forward to hearing more about their tremendous work. So where did it all begin for me? April 2010, fit, well, and just 50. An aggressive breast cancer with spread came to my door. This breast cancer saw me receiving everything bar the kitchen sink of treatments. But end of 2014, 4.5 years after diagnosis, with 3 new scares ruled out, but a combination of a highly pressured work environment and a number of debilitating side effects of mild cognitive impairment, increasingly impacting on my ability to do my job and with that my well-being, I very sadly gave up my career. A lifetime of working from 17 and my much loved job in education. If you ask me what was the greatest impact of that cancer, it was the impact on my working life, on my identity. Who was I now? Couldn't risk doing this today without my personal auto cue. August 2020 saw my husband with stage 4 mouth cancer and receiving a raft of aggressive treatments, but happily, with no spread, is currently believed to be cancer-free, and long may that continue. And now to this year, April 2023, I was devastatingly diagnosed with a standalone, incurable lung cancer. I can honestly say I never saw that coming. I am so grateful that the molecular makeup of my cancer has allowed me treatment that gives me best chance of length and quality of life. And my gratitude goes to the scientists and research that has resulted in my power-packed tiny nugget of gold tablet. The recent Penn Awards was additionally special as I left my oncologist to travel to Birmingham, directly having been given the first CT scan results since treatment started. And the best news I could hope to get was that the tide of cancer was being held back. And with that first evidence gave cause for real hope for my prognosis of 18 months to a few years. And believe me, I am aiming high. Since my much loved lifetime of working ended nearly 9 years ago, I have built one of the most rewarding and passion-filled careers in patient partnership, championing the benefits of working together with healthcare. But I'm not a bigwig or a big cheese. I genuinely see myself as a wee minnow floundering in this big sea at times, but by heck, I'm trying to be the mightiest minnow I can. So what does that mean to me? It means that I see myself as an equal partner in my own healthcare. Do with me, not to me, together. And what do I ask of my health practitioners? I ask that you treat me with the respect I will treat you with. I want your ears as much as your voice. I want your skill, knowledge, professionalism, and kindness. I ask for straight talk and honesty. If you think or know something, I want to know too, and I will greatly appreciate and work together with you for it. It also means recognizing patients as health experts too, and believing that best outcomes in anything to do with healthcare can only happen when we work in partnership, involved from the outset, not you and us, but we together. What has served me well is that I have never veered from my message of working together in partnership. I am not a critical friend, and I dislike the phrase. I am someone who genuinely wants to work together in partnership, learning together, and in so doing, improving experience and safety for both patients and staff. Building relationships and trust has been absolutely key, and this doesn't happen overnight. It takes time. Not falling at the first hurdle, and believe me, there will be a number. So perseverance is a must. Being genuinely interested in people and curious as to roles and why we do things has played a significant role too. And why is patient partnership so important to me? For me, it's everything. This is my body, my life, and anything to do with it, I should absolutely be involved with and part of. This is our NHS. When we work together, we are stronger and have the best chance of best outcomes for all, whether with your own personal healthcare or with the far bigger picture of healthcare and the NHS generally, helping to answer the key question of what is true value to a patient. In my own healthcare, I am the one constant in everything that happens. And whilst I can, I use my notes, knowledge, understanding to help professionals. And that, in turn, helps me. As we know, continuity of communication and care can be and is a significant challenge. Being involved can also increase safety as another catch point in the Swiss cheese model of multiple layers. So what do I say to patients and professionals? Seems so simple. It works for me. Build relationships by treating each other as you would want to be treated, and encourage, welcome, and respect what each can bring to the table, what wealth of experience and knowledge there will be. And since the end of 2014, that is exactly what I've done. Initially working together with the trust that saved my life in London, Barking-Havering and Redbridge University Hospitals, NHS Trust, and now with Kent and Medway Cancer Alliance and NHS England Cancer Patient and Public Voice Forum. I've been involved in a lot of processes and initiatives that bring improvement of experience to patients. This has seen me involved in so much: the making of 2 cancer support films for patients, quality improvement initiatives, patient safety work, raising awareness to symptoms of different cancers, to mention a few things. But at the core has been being out in patient areas, speaking with and listening to patients, relatives and staff, experiencing what they were experiencing and using what I learned to help me in my work with staff improving experience. And back in 2017, the first of our 2 cancer films, Getting to Know Us, won a Penner Award. Unique in that it was made by patients, for patients, together with an amazing group of staff. A true example of partnership working at its absolute best. We then went on using the same formula to make our second film, Getting to Know Chemotherapy, with more than 10,000 combined views, to hear from patients and families how they have helped them means the world to us. Since this year's awards, my work continues, and I am taking absolutely every opportunity to spread the word of partnership working, whilst also getting stuck in on pieces of work. I am particularly delighted, though, to have been in discussions with another large NHS organisation looking at how patient partnership could be developed, making connections, building links and looking at possibilities. I have now experienced recent excellent care in a number of towns and hospitals. And whilst I've been saying this for the last 9 years, I have never seen or heard how challenging things are now for staff and patients. Patient experience can't happen without staff experience. Patient safety certainly can't happen without staff safety. We are all in this together, which is why I believe we need to support and work together for the very best outcomes and experience for all. My nomination for this year's award did not come from an organisation. It came as a total surprise to me from an unbelievable group of people across the last 9 years, led by Emma, who it has been my privilege to work with. Staff and lay people who saw possibilities, displayed bravery with this new way of thinking, opened doors, walked through doors, sat at tables with me and welcomed me and other patient partners as we developed partnership together. To be nominated in this way was beyond precious, and to win the award was just the icing on the cake. To them, and so many others over the years, I couldn't have done any of this without you. This has always been about us together, and without the together, I wouldn't be here today. As long as I am able, I will continue. So, who am I now? I am the proudest of patient partners, and this is the power of partnership. Thank you.
Thank you so much, Sarah. And you speak so well about your experiences, about the importance of kind of connections, collaborations and relationships between staff and patients. And I think everyone on this call will kind of thank you for your courage in speaking as well as you do so, and expressing your views and experiences, and your openness to share and kind of willingness to use your knowledge and experience in partnership with others to kind of improve person-centered care. So thank you for joining us today. It's really appreciated. So let's move on to our next speaker this afternoon. So our next speaker is Linda, and Linda is joining us from the Public Health Agency in Northern Ireland, who won the Engaging and Championing the Public Award. So Linda will be taking us through some of the agency's work to improve the experiences of sign language users. Linda, I think you'll be sharing your own slides and you'll have control of them. So I'll hand over to you and you can start sharing, please.
That's wonderful. Thank you very much. I'm a bit blown away by Sarah's presentation, so I hope I can follow up with something just as inspiring. So yes, just allow me to introduce myself. I'm Linda Craig. I'm Regional Lead for the Regional Patient Client Experience Programme in Northern Ireland. And this is one part of quite a suite of programmes that we run, or initiatives that we run, to support people to share their experiences of health. And I was delighted to have been a finalist in the Penna Awards this year, but to be a winner was also a great shock to us, and has really helped us raise the profile of our work in Northern Ireland. So there's definitely ongoing ripples of appreciation when you're part of these award ceremonies. I've entitled my presentation The Golden Thread, and hopefully you will see that analogy unfold as I go through our presentation. But the sort of bottom line of it is that we all talk about having a golden thread in the health service. We all talk about, oh, that should be in everything. And really what I'm hoping for is that you'll be able to see that how engaging the public, engaging people from the very beginning, has to be a very clear and obvious thread through everything that we do. The main purpose of our project was to look at how we support people who use sign language to tell their story and tell of their experience, and allow of them to share with us their experience, and also support the community to make the changes in line with what they needed to see. And this is a quote from Charles Dickens from A Tale of Two Cities, and it talks about how that golden thread is about binding people together to that point of being a tightly knit community, family, close friends. And I think in essence, that's what we found we had to do when we came up with this idea of, we need to go out there, we need to make our mechanisms more accessible for sign language users, because they were very clearly saying to us, we try to tell our story, but we don't believe anybody hears us, and we don't even know that we're communicating it across to people in the right way. So this was really important to us, to try and establish that sense of community, bringing together, and really to do that, it was much of what Sarah has said about establishing those relationships and going to the people and asking them, what do you need us to do in this space? And to be honest, when I designed this title of the project, Listening to Sign Language Users to Improve Access to Share Their Experience, it came off the back of a colleague of mine, Dalreen Masson, who's not able to be with us today, who was doing a piece of work with the Point of Care Foundation, and she needed to finish with a project. And I thought, you know what, this one's great. This is quite straightforward. And I nearly thought I was coming with the answer, and I was going, do you know what, take that answer out there, Dalreen, and ask people if that answer works for them. There's a great arrogance in that thinking, because what we did learn was that we should never come with the answer, and we should never even think we have the answer, because when we really started to engage with the people of Northern Ireland who use sign language, we learned so much about them as a people, but also how we needed to build our relationships with them. The British Deaf Association were our keen and our key charitable partners in this space. But we didn't go alone with just the British Deaf Association. We did work with the National Deaf Children's Society and the RNID. So these are such valuable community and voluntary sector spaces that already had really good engagement. And what we knew was, by working alongside them, we could reach into the community and build those relationships and really work towards a really positive outcome. There was two things that really helped us in this space. So the initiative we were looking at here was Care Opinion, and we've had Care Opinion in Northern Ireland since 2020. It's the online user feedback service for Northern Ireland, and it allows people to give feedback on an online system, and it allows people to get a response from that service, which is, you know, been a bit of a game changer for our world. But Care Opinion in itself had a telephone number and a way of using picture tiles, but what it didn't do was it didn't quite reach that space of allowing people to tell their story in sign language and receive a response in sign language. And that's what people needed. That's what they wanted to see happening. And so we were quite lucky in the sense that Sign Video was another new contract in Northern Ireland, which allowed people who use sign language to use a telephone number, any telephone number relating to their care. And in this case, we're able to use Care Opinion and their telephone number. And what was the additional sort of challenge in our space was that when we went out to speak to sign language users, we knew the importance of translating everything from the spoken word to BSL, or from the spoken word to ISL, which is Irish Sign Language. And it was such an education for myself and Dalreen in terms of learning about different dialects and how things are said, and the different languages and how that's interpreted, and how you interpret sort of intent and emotion through sign language, that to use just things like, just a straightforward handwritten interpreter, you really had to have someone who understood sign language to be able to do the written word and to do it justice. So that was really important. The other really important bit was reaching across all of Northern Ireland. If you appreciate Northern Ireland, we do sort of run with quite a complex politics, but it was really, really important that we reached across the whole breadth of Northern Ireland. And this is just an example of 4 of the service user groups that specialise for either supporting someone who is deaf or a sign language user. And these were the groups that really helped us from the very outset to help us with, this is what we think the process needs to look like. This is what we believe we need to test of the process. This is how we need to change the process. This is how we need to promote the process. And can I assure you, the assumption that I started with is not what we ended up with. And that's wonderful in itself. So I'm not going to go through great detail of exactly what we did in terms of the finer operational bits of Care Opinion, but really to give you a sense of what did we set out to do? So we set to develop a mechanism for people to share their experience of health and social care. And we set to develop a mechanism whereby that response would come back in sign language. And then we sought to identify what mattered most to people who use sign language. And then there were some really important pieces we needed to understand around functionality. What were the opportunities? And that was mainly around sign video coming to Northern Ireland. And what were the gaps in resourcing? And the biggest gap that we did have in resourcing was having a deaf translator to take the written word, that being the response from a service, and turn that into a sign language video in both BSL and ISL. And that required some additional work around business cases and looking at what other resourcing we can feed into. It was essential that we piloted the process, and I didn't appreciate the importance of this pilot. This pilot was where I realised we actually had the relationship with the community, where they were like, absolutely, they trusted us, they let us use their stories, and they really leaned into the process and made it theirs. And that was really vitally important when we were reconsidering how we were taking it forward. And really we're at the final stages now, although we've went through a process and a redesign. We're now in a final stage where we're designing a promotional video. And so we have a number of our sign language users in that promotional video. And really we're doing it through role play, which wouldn't have been my first intent around promotion. I would have thought, is that right? But what was really important to them was seeing the role playing of the literally picking up the telephone, using sign video and walking them through the process. So I hope I've touched on a number of these underpinning principles that we have really seen that we needed at every stage of the project. And this is what I mean by the golden thread. It was so important to build the relationships. It was so important that there was an agreed purpose. And that purpose was very important because I was coming with my own sort of limitations to what we had available. I mean, money's always on the table, isn't it, in terms of we don't have all the resources that we might need. But to agree the purpose, to know what we were all striving towards, despite some of the limitations, was really important. Open communication was essential, and the last one is probably the biggest one for me, was the need to challenge assumptions. There was also assumptions from the community where they were going, well, actually, you don't want to hear our stories, you never listen to our stories. And that has come from a lifetime of them trying and really not the right mechanisms being in place. And so what was really wonderful was when they could see, when they told their story, how that changed things, how it made a difference. So one of our stories was a sign language user who during labour, during COVID, went in to have her first child. And because it was during COVID, her partner wasn't allowed in with her, but they also did not organise an interpreter to be with her. And she went through one of the hardest experiences of her life on her own, not being able to communicate effectively and say meaningfully what she had to say because she was profoundly deaf and nobody engaged in sign language. And that has resulted in a massive piece of work. And I think those are the sort of stories that people, she wanted to tell that story. She wanted to tell it in her language. She wanted somebody to listen, but more so, she wasn't doing it for any sense of complaining. She just never wanted that to happen to her or to anybody else again, which is a fundamental practice or principle behind why people tell their experience in the first place or get involved. So we're in the final stages, and I'm not going to overly labour this point. I think what I want to get to is kind of the final analogy of all of this. You know, we have come through this journey. We've come to review. We're working on the promotion work now, and hopefully we'll have the video ready for the new year. And we had everyone engaged in this cycle of learning from the very outset, which I think was crucial. But really, what I wanted to come to and why I entitled the presentation about being a golden thread. I hope some of you will appreciate the analogy of what happens. I'm not going to pronounce it because I don't do it justice. But in Japan, when something breaks, what they do is they rebuild it. And they rebuild it traditionally in gold. And they do that with the belief that what they're doing is recreating something more beautiful, but something stronger. Something of that appears different but has strength behind it. And the whole idea being that if we recognize the absolute importance, as we sit here today, we all probably sit at some point behind our desks and think, dear goodness, the system's broken. I don't think we can rebuild our system. We should definitely not try to rebuild it to make it look the same, because that's just the sort of the interpretation of doing something silly. Why would we do the same that we've always done if it's not working? But to rebuild it closely together, bringing in the partnership, making it much stronger, in recognizing that the people that are in our service are the ones that will help us rebuild this and make it much stronger, I think is of crucial importance. And I think one of the strongest learning from myself and our team whenever we were out working on this process, and really our challenge going forward now is doing the same in everything that we're doing. I'd be delighted if anybody wants to connect with us on any of the bits of work that we're doing or have any questions that need to ask. I've included our contact details at the end of the presentation. Thank you.
Thank you so much, Linda. I don't think it's an accident that both you and Sarah touched upon the importance of communication, partnership working, and being open to change based on what you're hearing from people about what really matters to them and the feedback they're providing, and certainly this idea of the dangers of assumptions and assuming what users want, and really like the fact that you and your team were just open to change based on what really matters to people, and the idea of the importance of testing change and using feedback to kind of inform next steps, which was really nice to hear. So thank you for sharing your experience today. Next on our agenda is a presentation from Laura and Darsha from Wakefield District Health and Care Partnership. So Wakefield District were the worthy winners of the Strengthening the Foundation Award. So Laura and Darsha will be talking to us about the Experience of Care Network, co-designed with people who have lived experience. So Laura, I think I'm handing over to you. I understand we'll be sharing your slides. So if you just let Lorraine know when you'd like to move on to the next slide, and we can do that for you.
Lovely, thank you very much. So thanks very much everybody for inviting us to speak at today's webinar. As Jenny says, Darsha and I are going to talk to you about the Wakefield District Experience of Care Network. Our colleague Nick from Local Health Watch, who is referenced on that slide, isn't able to be with us, but he's a vital cog in our network, and it's just a shame he can't be with us to help share our experience of developing the network. The next slide, please, Lorraine. So a little bit about Wakefield. It's a district made up of the cathedral city of Wakefield, as well as towns and villages with plenty of history and heritage. It's famous for rhubarb, rugby league, horse racing, Haribo sweets. It's the birthplace of Henry Moore and Barbara Hepworth. And of course, there lives the fabulous Jane McDonald. But some facts there about Wakefield District and the people, the health of the people in Wakefield District. But it's not the most, access to health and care isn't the most important determinant of health in Wakefield. Poverty, inequality, education, work opportunities, family life, and those other determinants have as great an effect. Next slide, please. So just a little bit of background about Wakefield District Health and Care Partnership. We work together to improve the health and well-being of the local people of Wakefield by reducing health inequalities, providing continuity of care and improving services. And we want to support our residents to start well, live well and age well. Our district has quite a forward-thinking approach to integrated working or joined up working across health and care. So the partnership includes our NHS organisations, Wakefield Council, Healthwatch Wakefield, and then working alongside housing organisations and the voluntary and community sector. So we've got a long history of successful partnership working, and that system working is about putting people at the heart of our decisions, our priorities, and our work. What else is unique about how we operate across our partnership is our place accountable officer. So our lead for the Integrated Care Board is also the Director of Adult Social Services at Wakefield Council and the Director of Adult Community Services at our local NHS Trust. I have no idea how she balances those three roles, but that's what she does. So her role and then other joint roles that we have between health and the council mean there's better opportunities to join up our health and care system, creating a connected system that supports people in their homes and communities to live healthier, happier lives. This is one of the foundations for our Experience of Care network. Next slide, please. So there was a King's Fund report published in 2021, which talked about how, as health services, we're really good at collecting people's experience of services at an individual service or a provider level. Think about patient surveys, think about friends and family test. However, what this report recognised is that's not how people experience services. So how do services work together across a care pathway to meet people's needs? How do we get that experience? The report talks about poor experience of care is often when those services aren't coordinated, and was definitely reflected when Sarah spoke earlier. And gaps in care between services can disproportionately affect those with the greatest needs and end up with the poorest outcomes. So this gave us inspiration and an evidence base for our Experience of Care network. The next slide, please. Right. So how did we go about it? Well, we started with a bit of an idea, an open invitation to colleagues, a blank sheet of paper, and some willing volunteers who helped us think through how could our network work. And what we created is a kind, welcoming and supportive space, a focus on pathways of care and a focus on what's really important to people. What does the data tell us that those things about experience of care that people are going through? And it gives us a shared view of experience of care for our population. We also created a space for peer support, where patient experience might be in somebody's job title in our larger organisations, to a person working in a voluntary sector organisation who does a bit of everything in their role and might want to think about experience of care. Next slide, please. So the network was co-designed with our partners from our blank sheet of paper, and we developed some aims and objectives for our first year. And then we asked network members to think about what are the key words that we'd want to pull out, which feel most relevant and ensured a collective ownership and understanding of our aims and objectives. And they're pictured there on that slide. So it's about ensuring the voice of people in Wakefield District influences the partnership's strategic work, their programmes for change, and so we can create that positive change for their experience of care. Next slide, and I'm handing over to Dasha for the next few slides. Thank you.
Thank you. So this one is showing the journey that we've been on since we started in November 21. You can see that we've had several meetings, several focused areas of discussion. Highlight of 2023 has been the Penner Awards in September. And what we've done since September is to hold another session of our meetings, which focus specifically around community mental health services, and we are already busy planning for next year and the meetings that will be taken into future. If I could have a look at the next slide, please. So in terms of how we've run and report the session, each session has a reflective look at experience of care data and the top themes from what our people across Wakefield District telling us about their experience. And that is what helps us to shape the work. That is what leads us to have each session with a specific focus. And over the 12 months, we've covered different topics, as you've seen on the previous slide, and they have been varied. This slide also shows how we report, how we look at the information. It looks at the key experience feedback, what are people telling us. It looks at the strategic context and some of the challenges, and we share those in an open and transparent way to really provide context to the discussions. But as a network, we look at what our actions should be and look at them in a collective way. And each member always tries to help with whatever the actions might be from their perspectives. And we are keen in including small and big actions. If we look at the next slide. So our key aim for year one was to establish the network and to grow its membership. And at the beginning, there were 8 organisations, including Healthwatch Wakefield, in the first development session. And since then, as the slide shows, we have grown to 16 organisations across the different sectors across Wakefield District. The spread of organisation is becoming diverse. We continuously getting new members, and we are continuing that conversation. And one of the things that has helped us through the Penner Awards is to almost renew that conversation around the experience of care network, getting more of a publicity and getting that renewed interest in it. We also are keen about capturing the benefit for those who get involved. As one participant within our network said, it's not just about information sharing, but it is about focusing on actions, about focusing on learning solutions and support. When we started, we agreed to have success criteria that linked to our aims and objectives, and we had 4. One was a greater positive sentiment and experience of care feedback, and we saw a positive increase between Q1 of the two years that are noted on the slide, where we went from 19 to 31%. Now, we can't directly attribute the increase on positive feedback to the network, but through the network, we are getting more feedback and data as colleagues are sharing more with us, and we are continuously working on the sources of data. We wanted to demonstrate how feedback has informed and influenced improvement in service delivery and transformation. And again, we've done that in terms of our focus discussions to our meetings. Proactive engagement and commitment from all partners in the district was something that we also set out as one of our success criteria, and we achieved that through our increased membership. And as my colleague already said, in terms of cherry on the cake or icing on the cake, one of our success criteria was to have a wider recognition of the network, and we were really delighted that we were shortlisted and successful at the Penner Awards. If we move to the next slide. Thank you. So as much as we were looking at our aims and objectives, our success criteria, and we did achieve those, there were actually additional benefits that we've had. And this slide really summarises some of the examples. The network has helped us to widen that information and range of feedback that can be used by organisations looking at relevant data. And it also champions the importance of working together to deliver those practical solutions for people to tell us what matters to them. So, for example, in one of our focused sessions that we had around access to GP appointments, we had a really good conversation, but what came out of that was what support needed to be put in place for patients in Wakefield District. And our HealthWatch colleagues produce really useful how-to guides to support people in preparing and getting the most out of their appointments. Our network, as Laura said, it is looking and ensuring that lived experience is considered within our planning, within our decisions and service delivery. And what has been great is the senior leaders within the partnerships are regularly making references to the network. They are talking about the value and output of the network and continuing that conversation around reflecting the lived experience in what all we do. And if we move on to the next one, please. So this one captures some of the feedback that we've had from those who take part in the network. It's also captured the feedback that we had from colleagues that we had during the Experience of Care Week, and it was really about having those pledges and conversations with our colleagues, and having the conversation during staff briefings and internally as well. And if we move on to the next slide. So the network does help us to have that single view of patient experience. It puts lived experience at the forefront of the services. And what we are proud of is the approach that we've taken, which is one of co-production, and it's been really valuable to have our HealthWatch colleagues involved in leading the network, as well as bringing people's voice into the work that underpins the network. And I'll hand you over to Laura for our final slide.
Thanks, Dasha. So what's happened since Penna? So what winning the Penna Award has meant is it's really raised the profile of the network locally in Wakefield and across the West Yorkshire health and care system. We've written a blog, which I didn't even know what a blog was before last month. We've talked at various meetings and we've reported through our governance arrangements into different committees. We've recruited some new members from the voluntary and community sector. So the recent session we had on community mental health services had a much better balance between statutory and voluntary agencies. We're also planning our second celebration event where we're going to actually revisit a couple of topics that we've covered in the past year, almost to close that loop, to close the circle on actually what's changed since you came and talked to the network about that area. And we're going to invite partners to do a bit of a show and tell about some specific initiatives they've taken to improve experience of care for people. I think on a personal note, Dasha, Nick and I are really humbled that our network's been recognised alongside so many fabulous pieces of work that we heard and saw in Birmingham. In our fast-paced world, we rarely take time to reflect on our achievements. So the whole process of sitting down and thinking about our award application, writing the bid, to finding out we'd been shortlisted, to the day in Birmingham, it's just been really exciting and exhilarating. And if I'm really honest, actually a little bit overwhelming at times. But it's given us more impetus to continue to grow our network and really focused on the mantra of joined up care can only happen with joined up listening. So thank you again for giving us this opportunity to share our passion for our network with you all.
Thank you so much, Laura, Dasha. And I know from other organisations that have submitted applications to Penna that just the act of going through that application can really give you time to reflect on how much has actually been achieved and the outcomes that have come from that. And I think it's quite a rewarding process to go through even before you kind of get to the awards stage. I really liked how you spoke about the kind of use of data, and you had the slide with all the kind of data sources on there and how that data was used to inform conversations and monitor and implement change. That was really nice to see. And I think the message of the importance of the network to actually help people when they're navigating through new services and multiple services and knowing the burden that an administration that can place on people as they're trying to navigate their way through health and social care. So the value of a network such as this to try and ease some of those pain points and make it the best experience possible is there to see. So thank you for sharing that with us today. So we move on to our next speaker this afternoon. So we have Oni from Nottingham University Hospitals NHS Trust. Oni will be talking to us about work Nottingham have been doing to ensure personalisation of care, and specifically to ensure dignity for people experiencing cancer. So Oni, I'll hand over to you. I think we'll be sharing your slides, so just let Lorraine know when you're happy to kind of move through the slide deck.
Thank you. Hi everyone, good afternoon. Nice to see you all, and thank you for making our time to listen to our presentations and for us to share and learn good practice. So my name is Oni Nwezo. I work at Nottingham University Hospitals, and I'm representing the trust today. I wasn't the only person that did the project, but unfortunately people are all busy, obviously doing patient care. So I will try my very best to go through all the slides and share what we've done. Next one, please. So we did the BAME Week project, and I will share how the journey began. Next one, please. So the project was done by the BAME Shared Governance Council, which is the Black Asian Minority Ethnic Shared Governance Council, which was formed in 2018 after our immediate past chief nurse, Professor Mandy Sunderland, took stock of how many colleagues that were from a Black or ethnic minority background that belonged to any shared governance council within our trust. And she found out that there was only 1% of all the colleagues within the trust that belonged to any shared governance council. For her, it was a worry because it meant that patients from an ethnic minority were not having their voice heard, and also our staff were not having their voice heard. So we formed the council, and our aim was to improve our patient experience and outcome, to improve our staff experience and also improve our staff retention, to work on projects that are affecting our ethnic minority community within Nottingham and Nottinghamshire, to link with our various BAME communities, and most importantly, to promote equity and inclusion for everybody, regardless of who they were. Next one, please. So when we started our journey in 2018, Mandy basically gave us a blank paper, and we were just allowed to actually form and shape what we did as a council. So what we did was actually to go out. One of the things we did was actually to go out and reach out to our local communities. I know most of the time people tell you people from an ethnic minority are hard to reach. They aren't. You are just not reaching them. They are rarely reached, and they can be reached. If you use the right approach and you go to them where they are, you would be able to engage with them and do anything and absolutely everything with them. So one of the things we did was actually Aquilan Chivingi, who was our chair at the time, actually went into our community because we saw a post on Twitter from our Sisters Against Cancer, who are one of our local community groups that actually meet and support patients and also carers of people who are undergoing cancer treatment. So Aquilan actually went in and actually supported and listened to our Sisters Against Cancer group. And they gave us various feedback about things they wanted us to improve. And subsequently, Aquilan and myself did attend some of their meetings, and the next slide would show you some of the feedback that we received from them. So there were no Black hairdressers on the list of eligible suppliers for wigs. There was a lack of variety of hair products for people from an ethnic minority. There was a lack of diversity among suppliers for wigs, and there was a lack of appropriate skin-colored products for our patients from an ethnic minority. And there was a lack of awareness amongst the staff that were looking after these patients. So in Africa, in Asia, and I'm sure in every part of the world, for everyone, but especially women, your hair is your pride, it's your beauty, it's your dignity. And when you lose that, you've lost your crown. And that is how our patients felt. Some of our patients were given pink wigs. They were given blue wigs. You imagine your parent, your grandma, walking in with a pink wig. And for someone from an ethnic minority, imagine your grandma, your mom, your auntie walking in with those wigs. Obviously, you think something has really, really gone wrong. It's not just the cancer, there was more to it. So this is how we left some of our patients feeling, and their feedback was quite painful to listen to. Next one, please. So what did we do about it? Obviously, we fed back to our chief nurse, who was our executive sponsor, and we reached out to various stakeholders. So we reached out to various divisional nurses, to our lead cancer nurse, to the Macmillan team, and we actually continued to reach out, most importantly, to the Sisters Against Cancer. We educated our colleagues about the importance of maintaining our patients' dignity, because unfortunately some of our patients did die before they actually got the vouchers for their wigs, which meant they died without that dignity, and it was quite painful for their family. We developed a patient information leaflet, so created the awareness about what to do and how to support these patients. We ensured that there was a regulated wig voucher for the patients to use. We identified various suppliers that provided hair products that were specifically for patients from an ethnic minority. Next one, please. And how did we do that? So we ensured that we audited providers and provided feedback. Again, some of the providers that we had were not treating our patients with dignity. When they go into some of the shops, they were being watched. Some of them were not given a private space to actually try the wigs on. Some of them that were not being spoken to properly. So again, we audited the feedback that were provided by our patients when they go into the shops. We developed a fact sheet for each provider with their pricing brackets to ensure that our patients got the best value, and also they were not charged more than they should. We reviewed how our voucher system worked, because we wanted our patients to actually get the vouchers before they lose their hair, and we didn't want some of them to pass away without actually having the wig and maintaining their dignity when they needed it most. We conducted real-time surveys as well, so we didn't just go on word of mouth. We ensured that we followed things up, and we continue to review our voucher system to make sure things continue to be in place for those patients. Next one, please. What else did we do? Again, when the patients were obviously getting the wigs, some of them began to complain of the pain in their scalp. So we didn't stop there. Although they had the wigs, they also needed their scalp looking after. So again, we went into our local community and we were able to liaise with one of our trichologists within Nottingham. So that the picture on the top far right was Aquilane and myself going into the trichologist just after the lockdown, when things opened up again, to actually look at the shop to make sure it met the infection control standards, health and safety standards, that there was mobility access for our patients. So when they come in, they were treated with dignity as well. So we collaborated with the trichologists, who not only made sure they had the right wigs, but also looked after their scalp as well. Next one, please. And this is when we went ahead and launched the wig project within our trust. So the lady with the red trouser is Dr. Rose Thompson. She found the Sisters Against Cancer. Unfortunately, Dr. Rose passed away in June this year, but we will continue to ensure that her legacy lives on. And the lady in the middle is Paula Edwards. She is now the current chair of the Sisters Against Cancer. And the lady in pink is our current chief nurse, Michelle Rhodes, who has been extremely supportive and ensuring that our patients are treated in an inclusive and dignified manner. And the lady on the far left is Aquilane Chivingi, who at the time was our chair of the BIM Shared Governance Council. Next one, please. So what did we do to continue to sustain the trichologist? We applied to our charity, the Nottingham University Hospitals charity, and we were able to secure some funding for the trichologist to actually come into our hospital rather than also having the patients constantly going into the community. We arranged it in such a way that when they come into hospital for their appointments, they could actually see the trichologist at the same time. So our trichologist comes into our hospitals. We have 3 campuses, but she comes into 2 of the major campuses on alternate weeks to see our patients. So when we started initially, we did start for patients from an ethnic minority. But when we launched the project, we got feedback from not just patients, but also staff that were actually suffering from alopecia for various reasons. So the picture on my right is actually a picture of members of our staff who were accessing this service, who also had hair loss problems. And the one on the left were from patients who actually came into hospital for various appointments, but were then accessing the service as well. Next one, please. Again, this is the leaflet that we share about the trichologist service. It goes out in a trust briefing. It goes out also in various social media forums. And we have also now got a community matron who now goes into our communities, into different communities, regardless of ethnicity, to actually share these leaflets and talk about the services that we offer within the trust. Next one, please. So what are we going to do and where are we heading from here? So one of the things we've done is actually go into the School of Nursing and Midwifery within Nottingham to talk about this project, to create awareness of how to look after the hair and the scalp of patients from an ethnic minority. So we will continue to liaise with our local schools, the Macmillan Cancer Support, a hospital charity who has been funding and keeps funding some of the projects that we do, our Sisters Against Cancer, and all our shared governance councils to actually promote this and continue to support our patients. So we're now getting requests from other trusts who want to learn from us. And again, we are also learning from other people as well. Next one, please. And that is us. Truly surprised, truly humbled to have won within our category. But we dedicate the win to Dr. Rose Thompson, who actually raised the concern to the trust. And most importantly, we are happy that we're making a huge difference in the lives of our patients. We started this journey for patients from an ethnic minority. However, it's now expanded to different groups of patients. Through doing this project, we've also realized that some of our transgender patients also lose their hair while transiting, and they're also now benefiting from this program. We've also got staff, we've got staff relatives, we've got various people that are now benefiting from a project that we started for just women from an ethnic minority. Next one, please. And the celebration didn't end there. About 2 weeks ago, we also won the Nottingham and Nottinghamshire Health Equalities Award under the equality category. So again, truly thankful for all the support we've received. It's not going to end there. We are going to carry on, and there are more projects that we're beginning to look into as well to ensure that our patients get the best experience and the best outcome that they deserve during their vulnerable time. Next one, please. And that's the end of my presentation. I'm happy to take any questions. One more slide, please, Lorraine. So like I said, we are dedicating this to Dr. Rose Thompson and all the members of Sisters Against Cancer, and to everyone who is still fighting the cancer. Please keep going. We've got your back, and we'll keep doing everything to ensure that you have the best experience and the best outcome. One more slide, please. Thank you everyone for listening, and always remember, Their hair is their pride, it's their crown, and it's their glory. Thank you. I'm happy to take any questions. Thank you.
Thanks so much, Oni. We're going to do questions at the end of the session rather than after each presentation. So if anyone does have any questions or reflections, please pop them in the chat or hang on at the end. And I can see some comments coming in there already, saying kind of thank you for your talk. And I think what I had was you really highlighted the importance of equity and inclusion for all, the importance of reaching out and engaging rather than sitting and waiting for people to come to you. And how your project really tackled those structural and administrative burdens that people can face when going through kind of experiences, and that simple thing you'd think would be there for people when they needed it. So kind of thank you for taking us through the project and how you've tackled that issue for people from Black and ethnic minority groups. So we're on to our final presentation of this afternoon. So we have Gary with us from Walsall Healthcare NHS Trust. So Walsall won the award for communicating effectively with patients and families, and they were also the overall winner at Penna. And they're overall winner for the work they've done to ensure the voices of children and young people are captured and listened to. So Gary's going to tell us a little bit more about the project, including how young people have been involved in the steering of that, and I think also something about tops and pants. So Gary, I think you've got your own slides and you're happy to control them, so please go ahead.
Hopefully you can see the slides, some nods. Yes, thank you very much. Good afternoon. My name is Gary Perry. I'm Associate Director for Patient Experience and Relations at Walsall Healthcare. On the screen you will see Charlotte Yale, who is our Divisional Director of Nursing for Children, Young People and Neonates, who's also the co-lead for the Little Voices work stream. So, what is Little Voices? And I knew this would happen just as I got into the swing of it. Hold on, let me just try a different way. I'm going to try just a little bit about the hospital, very short though, because I want to move into the nuts and bolts of what Little Voices is all about. But we're a medium-sized hospital serving a population of 270,000, with the 20th most deprived area in the country. Walsall is, and there's lots of new activity around our new ED and some children's provision as well within that setting as well. So in terms of Little Voices, it all began following the publication of the 2020 Children and Young People Survey, and some of the problems that highlighted for us as an organisation post-COVID, lack of engagement with children and young people, carers and their families. But more importantly, it allowed us the space to think about what types of things we would want to do in future in terms of patient experience and engagement with children and young people in particular. So Charlotte led an initiative called Back to Basics, taking everything back to the root cause of nursing, those foundational aspects of what good nursing looks like, but more importantly, how we can involve children and young people in changing the scope of the future of our services here at our small acute trust. But also key to all of this was recognising Article 12, the UNICEF Article 12, the rights of the child, but more importantly, the rights of the child to be heard, which led us to some out of the box thinking. So some existing mechanisms that we already had in place for gathering feedback from patients and their families included obviously the friends and family test. Tops and pants, very popular. So it's tops for anything that is good, and it's pants for things that children themselves are not necessarily feeling positive about. And there's a nice washing line on the children's wards with all those tops and pants clearly displayed. Ups and downs, that's the opportunity for parents to provide feedback. On our neonates, we use sharks and dolphins, so that's very much themed around the sea. We have a very strong parent support group in our neonatal unit as well. But also some of the new things that we trialled following Back to Basics was the onset of our patient involvement partners, and we've heard today how key they are to organisational change and improvement. Increasing the use of volunteers working alongside our staff in our children's areas, but also particularly useful for us when we're looking at play. and the onset of a mystery patient scheme. That's not independent people coming into the hospital doing some focused work, but actually it's given the opportunity by the use of technology for people to feedback 24/7 anytime throughout the year through the use of a QR code. And these are at the bedside in every bed space in the hospital, and very popular mechanism for getting more detailed feedback than the usual routes. So here's the team: Freya, Tommy, Alfie, Caden, Melody and Molly. They are the real stars of this show. And we've heard today on a normally ordinary Wednesday afternoon, dull and dark it is here in Walsall, cold as well, but I think all these presentations and hopefully some of the things you'll hear that the Little Voices have actually been involved with will bring some warmth, happiness and lighting to your lives this Wednesday afternoon, because it really is phenomenal work that our Little Voices children and the team have been delivering. So what did they do? So Little Voices, we went into the school, we partnered with a local primary school, a school that is a good school, but it has significant challenges. Particularly it's where the national curriculum is very much focused on creativity, because there's some learning objectives for that school, challenges around children of concern. Some families have, and children have looked after children as well. So the pre-visit focused on all the tools that we needed to do the job. So we revisited the NHSE 15 Steps Toolkit. We made it child friendly by co-designing a new approach with our Little Voices children. We had lots of conversations about what to expect before they came into the hospital for their first visit, i.e. who we were, what we do, what to expect, what they may see, what smells, what the organisation will look like, what things they're likely to encounter was really important for them. How to use the toolkit, what to look for, and then obviously conversations around confidentiality, what that meant. And the children did a focus session on learning new words, so knowing what paediatrics meant, knowing what confidentiality was as a word. So in terms of English and some of the stuff that they can go on into school to build on, writing skills, all sorts of things were at play here. And more importantly, our infection control work. The children designed a hand cleaning observation sheet with our infection control lead. And we did lots of work around the importance of hand washing, hand hygiene, more importantly how we grow bugs that can tell if people are not following correct infection control practices, which really excited the children, especially passing the poo round, which you can probably see was a very exciting moment for them all. And even more so was when they learnt what that grew when they came back onto site to visit. So that's just an example of what the toolkit looked like, that redesigned toolkit. If you've seen the NHSE examples, they're very good, but they're not always very friendly. So this is the child-friendly version with some change in wording. So the head teacher and the group of children work with us on words that children would understand, because this is their voice, not ours. It's not an adult doing this inspection. It is the children's voice that is critical to this work stream. They designed an audit tool so they could assess the lunch. So we gave them lunch whilst they were here, and they were able to tell us whether or not it was the right portion size, whether or not it satisfied them, whether it was hot, and what the taste of that food was as well. But also an opportunity for them to talk to us about their day. So as we bring children through this scheme, and we'll go on to involve other schools and other partners in this work stream, tell us about the day. What was best parts, what was tops, what was pants? As you know, that will feature quite a lot. And here's some of the things that they said. So they visited our paediatric unit, they visited our children's ward, they went into our ED department and our assessment unit. And our ED department PAU area is very new. It's only opened in April of this year. So there's still a lot more to do around making that engaging for our children. So lots of things about scribble walls, but no pens. You think that's a very basic thing that we should have got right, but the children picked it up immediately. Hand gels not being at the correct height for a child or even someone in a wheelchair, as one of the children quite pointed out quite robustly. More colour, more pictures, more engagement, themed pillows, linen. They picked up on a mirror in the sensory room, which they felt was dangerous because it wasn't that visible when the lights were off and going in the sensory room. And toilet signs, very key to children, particularly because the infection control work that they've done was making sure that, yes, we know that there are toilets on these areas, but where are they? We can't see the display. And for a little one, they said it's important they know where the bathrooms are as well. So since then, and since our wonderful Penna Award, which again has opened up lots of opportunities, everyone's been saying today, for us, a real opportunity to showcase, work with other trusts and collaborate. We've done a lot of we did. So we helped, we're midway through designing our new playroom. So the children had a look at it, had a look at what was going on in there, and that's now been formally opened on our children's ward, because play was key to the national survey as an outcome. We've now got our Enhancing the Ward Experience volunteers working within the children's areas, supporting the play specialists with the delivery of play and engaging with children. We've now had a hand gels. Since I produced this presentation, they're now being lowered with new stickers on that the children design, so they're visible to a child's eye, encouraging hand hygiene. And every toilet door has one of these A0 posters on, so people know how visible where those bathrooms are, and obviously reinforcing those hand hygiene tips. Of course, we also then went further and we've launched It's OK to Ask, a children's version of that initiative, particularly focused on those 3 questions for parents and carers about understanding what's wrong with their child, how they can get involved with the child's care, so it sits alongside the patient voice. We've signed up and we're about to go live with the Little Journey app, which is very much a digital app that helps children who are coming into hospital for surgery. It's to reduce pre-hospital admission anxiety, and again the little voices have been key to the design of that. Even the avatars that are being used are going to be our little voices, so it's again, there's a legacy here for those children. We won a gold award for the Infection Prevention Society National Awards, International Awards, I believe, for infection prevention and the involvement of children in hand hygiene audits. And our patient voice reports, they've not just been launched across paediatrics, they've been launched trust-wide with lots of data and intelligence around what patients are saying about those areas. More importantly, some of the good things that are happening. All of our paediatric units, since the onset of this initiative, all of those children's areas are now scoring consistently 90% and above in the friends and family recommendation, which again was a key challenge to us a lot earlier on in this process. And finally, because I don't want to go over my 10 minutes, because I know I did, that was my mistake at Penna, and I'm not going to do it again. Finally, gift-a-gown. Some of you will have heard me talk about that when we were at the National Awards. And that's an idea that we had to support children who often come into hospital, particularly in an area like Walsall that suffers deprivation without hospital wear, nightwear or gowns. So our Gift a Gown appeal was launched in October. I'm sitting in my office now, there's bagfuls of brand new pyjamas, dressing gowns, slippers, all for our children, so that nobody has to the embarrassment really of being in hospital in day clothes, because the families have no resources to buy them nightwear. We've been back into school and we've worked with the children on our Sleep Time Matters initiative, which is our last but one slide, and I'll tell you what the upshot of that has been. The children have also taken part only last week in our Desert Island Discs approach to staff recruitment. So some new nursing staff who were recruited for our children's ward. The children have come in. Andy, who's my patient experience manager, led a Desert Island Disc approach to involving children in the recruitment of some new senior nursing staff on our children's areas, which was really exciting, and the kids were just unbelievable as ever in that. So our Sleep Time Matters, we're having a focus on a lot of themes now. So meal times will be next. Sleep Time was our last initiative, so the children helped us design a toolkit for encouraging sleep, why it matters for children. So it's directed at parents, but them as well. So when they're in hospital, they can use the toolkit in terms of what matters to them. And going back to that you said we did approach, obviously one of them was around linen and things that belong. So for infection control reasons, it's not possible to have children's design linen in every bed space, but we are now going to encourage people to bring a favourite blanket that a child might have into hospital through our Bring a Blanket approach, which fits in with a whole sleep time matters approach, including oral hygiene and mini mouth matters as well. And this toolkit is now being used on our children's areas. I don't think I've missed anything else out. It was a fantastic opportunity for us to showcase. And like everybody else, we were overwhelmed with not just the category winners, but being the overall winners really shone a light on us. And I'll go back to what I said, linked in really to Article 12. And I think I said this at the conference as well. And that's listening to the child's voice. It's crucial. It's crucial for understanding their perspective. It fosters good communication. It promotes their emotional well-being as well. And we're seeing that through the designs of the toolkits that we're now using. It builds trust. It encourages self-expression from children and young people, but it ensures that their needs, their concerns are acknowledged and addressed. And like everyone else has said, we're happy to support any trust, any organisation who thinks they can learn from this initiative, which is very simplistic in its approach, but massive in its impact. Thank you.
Thank you so much, Gary. I didn't think I'd see a cuddly poo as part of anyone's presentation today, but I think it demonstrates kind of the great creativity and engagement that you've shown us in your presentation, and such a fab range of resources that you've been able to develop to engage with children and young people. And I also really liked how you spoke about the skills that you were able to provide children and young people around kind of reading, writing, learning new words. I think that was excellent to see as well. So thank you, and congratulations as well for the overall award.
Thank you.
So that's it for our presentations for the webinar. We have a short amount of time for questions, but I just wanted to take the opportunity to say a big virtual thank you and round of applause to all of our speakers. We really appreciate you all being with us this afternoon, and we want to thank you for sharing your experiences of driving positive change in people's experiences of care. So thank you so much. We've got about 5 minutes for questions. If anyone has any kind of questions or comments that they haven't managed to put in the chat that they'd really like to reflect on or ask our presenters, then please raise your hand and we'll attempt to bring you off mute.
Jenny, there was an open question about reaching underrepresented groups. I'm not sure if there's a chance to get a quick thought on that, but it's an ongoing theme, isn't it?
Yeah. Can you read the comment out to me, Ruth, if you still
So open questions of speakers. If in any of the patient experience networks, how did you reach underrepresented groups to join the network? If certain cohorts and in certain cohorts and seldom hurt groups, so if they didn't respond to the open invite, how did you reach out to them?
Thank you, Ruth. Linda, you had your hand raised and then immediately came down, so I don't know if...
No, I took it down because I thought maybe I was being a little presumptuous, so apologies for that, Jenny. I wanted to reinforce which one of the other speakers said. There is a sense of, and we've used the term for so long now about feeling seldom heard or being seldom heard. Communities just aren't seldom heard. They're just not asked in the way that will engage them. And I think this has become a big priority in the Regional Patient Client Experience Programme in Northern Ireland, about how do we work in these communities, how do we build those relationships. And one of our key sort of approaches to this is to get alongside people. So we did have a massive campaign to support people from Black and ethnic minorities to tell their stories on Care Opinion about a certain aspect of care relating to maternity. And what we realised was when we actually got speaking to people within the community, where English wasn't the first language, there was a real sense of why on earth was the government coming to ask that question. And so there's a level of trust that we had to build up and a relationship we had to build between the communities and ourselves to be able to assure people that it would make a difference and that we were wanting to hear them. And then I think also to allow them to understand the importance of their story and how we would use that as well, and let them value their story and their experience. So I think in some ways, working alongside communities, community leaders, community and voluntary sector, we are taking that approach more so than just sort of going out with social media or a blanket canvas type approach to invite people, focusing mainly on building relationships.
Thank you, Linda. Oni, would you like to come in with your reflections on that?
I think, like I said, it's actually going into those communities. So going into their churches, their mosques, their synagogues. And one of the things that we've done within the trust is to appoint a community matron, one specifically for maternity and one that deals with every other thing. So we actually target when these communities have like the yearly community events. So we actually take our services into the community. So we have, for example, a Gambian community and a Filipino community. They have big events in Nottingham every summer. So we tend to take some of our services like the breast screening. So we take a dummy, we teach them how to check for breast lumps. So we take our liver services there, the hepatitis team. So we actually take those services into the community where they are and where they feel comfortable. Again, don't forget, some of these people have no trust in the system because some of them have faced racism, some of them have been treated unfairly. So one of the things we've actually done is actually got people that look like them, people that speak the language, that can be that link with that community as well. Again, when you look at some of our researches, Jenny, they will tell you you have to be able to speak English. Well, if they can't speak English, how would they engage in research? How would they support anything that we're doing? I know Professor Joe Cooper within the CNO research team is actually looking into that, but it's also about us rethinking some of the criteria that we put out when we put out some of these things as well. I think the other thing to remember is the different generations that we have. So how do we communicate these things? If you communicate things only on social media, people from an older generation would not engage. So it's also finding different means and ways of communicating these things to our patients and the community in general. Those are just my thoughts. Thank you.
Thank you, Anya. And I think you're right. It's about those kind of deep connections and partnerships that you're able to forge with people, which really help with the work that's being kind of carried out in all the projects we've heard from this afternoon. We've just got a couple of minutes left. So what I'm going to do is wrap up for the session. So I'd encourage anyone that's got any kind of final thoughts or reflections, please pop them in a chat for our speakers. So as we wrap up, Ruth, I'd like to hand over to you for a few final words, if you may.
Thank you. Thank you to our speakers. Sometimes you hear things, but you don't hear things. And so it's great to have had a chance to listen again to these presentations. So first of all, if you've been inspired and you want to take part next year, the dates are in the chat, but if you missed it, it's opening on the 8th of April, closing on the 18th of July. And if you've got any questions, if you're got any concerns or you feel that maybe it's not quite right, just get in touch with us and don't wait until the 8th of April. We can take any questions now. So I put Helen's email in there. She's not on the call, so it's her fault for not being on the call, but she knows everything about the awards. The second thing I wanted to say is we have a wealth of resources, and I know I've probably bombarded you with way too much stuff in the chat when I got access to it, but normally, if you're thinking about doing something, someone else may have done it before. So it was great that Gary mentioned Little Journey, because Little Journey submitted a few years ago. So if you want to find out about Little Journey, then go and have a look. And there's been some great work around reaching the hard to reach. Tony Kelly called them the historically ignored. But you know, there's some great examples. So just go and Google. Search on our website and you may find something. That's me. Thank you for joining us, and thank you, Jenny.
Thank you. Yeah, no worries. Thank you so much, Ruth. So just a final reminder from me that the session has been recorded and it'll be available on the Picker and Pen website within a couple of days. So please look out for that. And it's a final big thank you from Picker and Pen to our speakers and to everyone attending today. We hope it's been a useful session of learning and inspiration, and we look forward to seeing you at future Picker events and of course the Pen Awards 2024. So thank you very much.
Thank you. Good afternoon, everyone.
Thank you.
Bye. Bye-bye.
Thank you to our
Bye.
fabulous speakers. Thank you. Thank you.
Thank you.
Thank you, everybody. Bye-bye.